Thank you, Mr. Chairman, and I want to thank the panel for being here today and for bringing your expertise and your care. It's important information that we're talking about here, and I appreciate it. I want to get a little bit specific here in this all products clause, Dr. Gallant. I'd just like to read this back to you. All products clauses obviously assist Blues plans in building their provider network, but at the cost of denying physicians the freedom to choose their own patient pool and workload. I'd like to just for a second take a patient perspective on this. You mentioned a number of plans that the Blues may offer, from an HMO to a certain provider plan to a statutory plan like workers' comp. And I think of a patient that may tear their rotator cuff while playing tennis, and you come in and you repair that, and then maybe 3 months later they're injured on the job and they tear their other rotator cuff. But in this case, this all products clause without that would allow you to treat them for the first injury, but then tell them that even though you're my patient, I don't want to treat you under that statutory element, the workers' comp. And I'm concerned about that from a patient perspective. Can you tell me about that?
Well, most of the products reimbursement is favorable, but some are not. Some we actually lose money in treating that particular patient. And that's really the point of that. But no, I understand what you're saying. Okay, you have a comment?
I mean, from the patient perspective, that's pretty tough love.
I think a lot of orthopedic surgeons probably would treat that patient anyway, especially if they're on that employer's panel and don't know, perhaps that the carrier is aligned with that employer. But I understand what you're saying, and we can get some further information about this for you.
Just can I make a comment on the product issue? And again, from the family practice side, I know that some family physicians in the state will not take a certain product because the prior authorization process can be so onerous. For example, 2 weeks ago, I tried to get a CAT scan on a 2-year-old. They came in with a 12-centimeter mass. It took us 2.5 hours to get authorization to get a stat CAT scan on this child who was just operated on. So the prior authorization process can be so time-consuming, especially for an office where you have limited personnel in the office, as was alluded to earlier, that it isn't worth the reimbursement because you spend so much time trying to fight for every drug and test.
Yeah, again, look, when I take the patient's perspective on this, I just see a lot of people that are potentially, and workers' comp is only one example. I mean, you've obviously got medical assistants in other areas, and I think here we are certainly concerned, as you are, about a continuity of care, and the example that I just gave you is certainly a concern of mine, and if you can get us more information on that, I would really appreciate it. Look, elements of this settlement have already expired. Have you seen an increase in denials since that?
Yes, we have. There's a major plan in the Southeast that's already looking. They're supposed to have a limited time for look back. They're going beyond that. They're going back to their prior, looking back longer period of time, doing retrospective denials, reverting back to prior bad behavior, and reneging on what the provisions of the love settlement are. So we are seeing that already taking place.
And have you sought redress through the insurance department, through regulation, rather than a change in the law?
Mary Ellen can answer that better, actually.
When we've seen that happen, and they've been, for the plans that were still under the settlement, we've been successful in working through the settlement officer, but for those where it's expired, out of luck. That's it. We've also seen an increase in audits by health plans, audits where they're now going back and applying coding edits, if you will, that would include the bundling and some of the other things that you heard here, the terms that they weren't doing before. Now that the settlement, has expired for them, they're, finding ways to through the audits to go back and ask for a great deal of money back from physicians for services that they provided 2-3 years ago.
I've been trying to get the insurance department to address Blues contracting issues for the better part of 2 decades, and the insurance department has never once even come close to doing anything from a regulatory standpoint. That is a non-option. In fact, on behalf of Dr. Cutler's group, in September of 1997, I filed a comprehensive petition for review with the insurance commissioner, and I've yet to get a response. So legally, and I don't know if any of the other groups have different experiences, but from my experience representing physicians of every specialty, not just the family docs, the insurance department is not an option.
Okay, thanks.
Representative Tobash, I wonder if we could just go back for a moment to the all products clause, and if I could just share a primary care perspective on that. Coming from a small practice, there are times that we can't accept a large number of patients. We simply don't have enough doctors and enough staff, so we have to make decisions that will take part of a plan but not the entire plan. And so going back to your question about the fairness to the patients, if we accept too many patients, we can't get them in to see us. So it's unfair to the patients when they can't come in to see us. So there are times that we have to limit our practice because of our size, and IBC in particular in the southeastern part of the state controls so many patients that we have to make those decisions.
And I guess I understand that from a plan perspective, but really from that patient perspective, you've already accepted the patient, but now you're not so sure that you want to accept the workers' compensation settlement or the other payer option here.
I don't think any doctor would turn down a patient who's acutely ill and in the office or in need of care, but in a global sense, when you're negotiating a contract, if you take on too much work, you simply can't perform the work. It's a basic business principle, I suppose.
Great. Okay. I understand. Thank you.